In the UK, long-acting antiretroviral therapy became available in 2022. I work at Barts Health NHS Trust in London, and we have been using this therapy since 2022. We have about 200 patients in our trust on long-acting injectables, and initially there were some expectations that the medication may be logistically difficult to deliver, that patients may miss appointments, and some patients may not tolerate injections. In fact, our experience has been that patients are well motivated to attend appointments, that the injections are effective and well tolerated, and that they make a meaningful difference to patients' quality of life.